I have depression. That's only one sentence, but it carries so much weight. The weight of shame and guilt on you if you have it, and the weight of fear and confusion in your loved ones, even though it's nobody's fault. About 280 million people suffer from depression worldwide, which makes it the leading mental illness in the world. However, people find it hard to understand what depression actually is. It's not the same as a temporary feeling of sadness that comes and goes when circumstances change. Depression doesn't go away the next day, and the next day, and the next one. When you have depression, you can't concentrate. You completely lose your interest in hobbies. You constantly feel tired. You can't sleep or sleep too much. Worst of all, you feel lonely and ashamed. Did you know that it takes the average person suffering from a mental illness over 10 years to ask for help? You may wonder why. Opening up about depression is not always easy. It's hard, actually. You not only fear judgment from social stigma, but you also keep putting pressure on yourself by thinking, I should do better, I should be happy. That's why many people hide their depression, telling you they're fine when inside they feel broken. Since depression symptoms are intangible, it's hard to know if the person is actually struggling. And in most cases, a person with depression won't be the first one to open up about their condition. If someone in your life has depression or might have it, you may feel helpless and wonder what to do. But you don't have to be an expert to talk about depression. There are small things you can do to make a big difference for a person who feels lost. Start the conversation. Let the person know you're there for them. You can start the conversation by sharing your concerns and asking specific questions such as, it seems like you've been having a hard time lately. What's on your mind? Or, the last few times we hung out, you seemed a little down. Is there anything going on with you that you'd like to talk about? The person may not feel like talking the first time you ask. Ask twice and show you're open to hearing more when they're ready to talk. Always listen carefully, but avoid giving advice such as, just be positive, or go outside, take a walk, it'll help. Also, if you haven't experienced depression yourself, avoid comparing it to times you felt sad. Comparing what they're experiencing to temporary feelings of sadness and giving them advice can make them feel guilty and ashamed for struggling. Listening is often even more important than talking. In most cases, people with depression find it one of the most powerful healing tools. Offer to help with everyday tasks. Depression can be draining, so the person may struggle to keep up with everyday tasks. Ask the person how you can help, but give them space to say what they need from you. If they're behind on dishes, laundry, or other household chores, offer to come over, put some music on, and do a specific task together. Simply having company can make the work seem less draining. Help to find support. People with depression find it hard to seek professional help. Even though they may know it can help, it can be really hard to search for a therapist and book an appointment. Gently try to offer the person your help by looking up therapists and making the first appointment if the person agrees. Don't treat the person differently. Even if your loved one is having a hard time, it's still the same person you know and care about. Don't treat them differently. Keep inviting them to social activities and offer to do the things you'd normally do with them. Even though they'll reject your invitation from time to time, they won't feel isolated and left out. Be patient and don't take things personally. Depression symptoms do improve with treatment, but it takes time. The person may continue to have symptoms from time to time. Try not to take things personally when they keep canceling plans, lash out at you in anger, or don't want to talk. You might feel helpless, but remember that you need to be patient. Depression doesn't have a clear recovery timeline. Just let the person know you still care about them as they continue to work through depression. Open conversations about mental illness can help fight mental health stigma and make it easier for people to ask for help. If you know someone with depression, please don't walk away. Listen. Ask twice. It's time to talk.